Hi, Dr. Robert Fusco, a clinical gastroenterologist, here to answer some of your questions. Swallowing is a very complicated process. We don't really appreciate all our body functions. This one's controlled by a small computer in the base of your brain called the medulla oblongata. You have to remember you have two passageways. You have the windpipe or trachea that goes to your lungs, and the food pipe or esophagus, which goes to your stomach. They're different. The trachea has circular bands of cartilage, so it's always held open, whereas the esophagus is collapsed like a collapsed party balloon until you swallow. Here we have a picture of the anatomy. You can see we have the nasal passage, have the mouth with the tongue and teeth, have the back of the throat, and then the two pipes, the windpipe and the food pipe. Now take a deep breath. As you do that, you expand your chest, you drop your diaphragm, you create a vacuum in the trachea. This sucks air through your nose and mouth into your lungs. Then you breathe it back out. Very simple, not too complicated. Take a bite of a hamburger, it's a totally different thing. So you take a bite of the hamburger and you chew it, you kind of moisten it with saliva and you crush it. And then your tongue pushes to the roof of your mouth and forces the food back into your throat. Up to this point, it's all voluntary. Once that food hits the back of your throat, however, the computer in your brain, the medulla oblongata, or autonomic nervous system, kicks in. It's not voluntary. It has to make some decisions. When the food's in the back of your throat, it can go one of four directions. It could go up into your nasal passages. It could go back into your mouth. It could go into your windpipe, or it could go into the esophagus where it's supposed to go. How does that decision made? What allows it to go in the esophagus but not your windpipe? Well, the first thing that happens is a little part of your palate called the soft palate. If you feel the roof of your mouth, you feel the hard palate to your tongue. Behind that's the soft palate. And the first thing that happens is the little computer in your brain turns on a switch and flips that up. That blocks your nasal passage. And the fact that your tongue is pushing against the roof of your mouth pretty much blocks the oral passage. So we've got two blocked already. It's not going to go in your nose. It's not going to go back into your mouth. Now you have two choices. The food can go into your trachea or can go into your esophagus. Well, food in your trachea would be aspiration. That would be disastrous. Choking and coughing and maybe even worse. How do we direct the food from the windpipe to the food pipe? Well, the little computer in your brain senses that it's coming down and it flips a switch and pulls the epiglottis down across the opening of the trachea. That's called the glottis, the opening. It blocks the glottis. Now the food can't go in your nose, it can't go back in your mouth, and it can't go in your lungs. It only has one place to go, and the little computer signals the esophagus to begin to pulsate with rhythmic contractions, pushing the food down the esophagus into your stomach. So you're there at a Steelers game, eating a kielbasa, drinking a beer, yelling and screaming and swearing, and so excited. You're breathing, you're chewing, you're swallowing, you're talking. It all happens in milliseconds. The food goes down the food pipe and the wind goes down the windpipe. And very seldom does it get mixed up. The human body is amazing. It's amazing that little computer in the base of your brain can sense what's happening and regulate all those little switches. There's 25 different muscles that are involved in the process. And we swallow about 900 times a day on average. During our sleep, less often. Just another part of the body we don't appreciate is the upper digestive tract, the swallowing function. Dr. Robert Fusco, I hope that answers your question.